Now, the swearing-in ceremony of the newly appointed members of the Free State Executive Council, Free State Premier Maqueen Letsoha-Mathae appointed MECs on Wednesday this week out in Bloemfontein. And SABC News reporter Makgala Masiteng joins us live now from Bloemfontein with the latest. Okay, a very good afternoon to you, Makgala. So talk to us, what about has happened so far in the swearing-in of the Provincial Legislature?
Well, Alicia, we have indeed seen the swearing-in of the new MECs in the province, and soon after that, as you can see behind me, we are now at Bloemfontein Hospital. Then the new Premier Maqueen Letsoha-Mathae then took the members of the Executive Council to do some of the visits, I'm told, is here at Bloemfontein as well as national. They will also be going to other areas after this. But as soon as we arrived here, just as they begin with their visit here at Bloemfontein, obviously we have started already hearing some of the issues that are disturbing when it comes to health issues here in the province. We know that it is not the first time that we have heard of issues concerning Bloemfontein Hospital, and among others, what I've heard some of the staff members talking about was the shortage of staff here, but also the issue of patients that find themselves having to sleep on the floor because of the shortage of beds. But there are many issues here, and I'm standing with the new Premier Maqueen Letsoha-Mathae as well as other MECs, including the MEC of Health, Makgala. But I would like to bring in the Premier just to talk to her. And of course, this Premier was an unannounced visit, as you have indicated when you began your role as the Premier, that you want the members to be on the ground. I'm guessing this is one of those.
Indeed. I indicated that we really need to hit the ground running. And this is one of the commitment that I made to the people of the Free State. As I said, once you are in, your officially MECs, join us. Let us not waste any hour without attending to the issues that are affecting our people. That's the reason we are here. And that's exactly what I committed to.
Talk to us about just your reaction with what you have seen. Already I've heard you from a distance. I could hear you in your voice that you were not happy at all with what you are seeing here.
Of course, I am not happy at all. But what I've observed here, it's an issue of management. Sometimes when you deal with people, put yourself in their shoes. How do you survive when you don't have ablution facilities in an area? How do you survive in your own house when you cannot access a simple thing like toilet? So really, it's really embarrassing to us, and I really appreciate the team that is here, and we are here as Treasury also is here, MEC for Public Works, so that by tomorrow something must be done here in this institution. There is no way we can allow our people to live in this kind of conditions.
Talk to us to some of the issues that you have had since you have arrived. You talked about the ablution side. What else is missing here?
Now, we're told about the shortage of staff, the shortage of blankets, for instance. And I think those are the main issues that the people complain about. And like I indicated, this one of toilets not functioning, I mean, it's something that can be attended to. And like I indicated, that I think the issue is management. And the new MECs here with me, we must really attend to that with immediate effect. And also, MEC for Public Works, we are going to have to really deal with these matters. We have artisans, we have these programs where we train people, and we can just bring that team of artisans, of plumbers, to just come and assist us here. Hence I'm saying it's an issue of management, because management, you just have to apply your mind and say, even if there's a shortage of money here, but the government has this kind of resource, how do you utilize that resource? That's all I'm saying. We lack management. That's the simplest way of dealing with this matter. Yeah.
Let me bring in the new MEC of Health, Makgala Masiteng, of course hitting the ground running. With what you have seen, just your views.
I'm not happy with what I'm saying, and like the Premier has indicated, we're going to attend to this matter as soon as tomorrow. I have directed the HOD and the acting CEO that tomorrow at 10 I'm meeting with the rest of the management team here, and we're going to address to this problem and other problems. We are going to receive a full report about the status of this institution, and we are going to attend to all the problems so that we don't have to come back here over and over and over again. I know my predecessor has been here several times attending to the same problems. We are not going to play that game again.
I was going to talk to that point again, that this is not the first time we're hearing issues with regards to Pelenomi Hospital, of course with other issues in other hospitals as well. As you enter into this department, what is your vision?
It will be difficult to outline my vision now. I haven't received a full briefing and an orientation. I need to get the facts. I need to know the status, and then I can develop a vision that will not be thumb-sucked, but that will be based on the facts that I will come face to face with. I'm meeting with the management team of the department on Tuesday at 10, and I'm meeting with the CEOs of all the hospitals at 2 on Tuesday. And thereafter, I'll then have a picture. But still, there are internal stakeholders that I must engage. And after engaging those internal stakeholders, then we'll develop a vision of the department. We'll make an announcement, and we'll come and share that with the province after getting approval from the Office of the Premier.
But definitely the issue of Pelenomi coming first after seeing what you have seen today.
Pelenomi comes first, and I've had an engagement with my colleague from Public Works. She has offered that she'll come and assist us on this project. And like the Premier has indicated, the MEC of Treasury, if there's a need. But it's too early in the financial year. I think there's resources in the department to address this problem. But as the Premier has indicated, we are going to work collectively as the executive of the Free State to address this problem. It's not going to be a health problem. It's going to be a problem of the executive of the Free State. We are not going to function in silos. We're going to function collectively.
I'm going to put on the spot the MEC of Public Works. At least it's not the first time you are continuing with this department. Of course, this issue goes back to your department in terms of the infrastructure as the Department of Public Works.
Thank you very much. As things stand, each individual department is responsible for maintenance of infrastructure. However, like Premier has indicated, it is important that we work together. As we speak, we have advertised for positions for artisans whom we are going to have an intake in about a month or two, which is expected to come and assist for situations of this nature. Where we are saying these 1,000 young people who are plumbers, who are plumbers, painters, carpenters should be able to do basic maintenance of day-to-day. It can't be that you get into a hospital, then there's no ablution facility, or there is ablution facilities, but they are not functioning properly. We should be having a battalion of about 50 young people who will be stationed here, so that when such things are happening, they are just on call to be able to assist. This includes libraries, this includes schools, and so forth and so on. We're saying let's just reduce on major construction that is done by external stakeholders through contractors, but use our young people who will be trained within the department. But over and above, we've got other departments that have trained artisans. We should be looking, like Dr. Matlas has indicated, we should be working as a collective, but that is a plan to say we must build artisans, we must build internal capacity as the Department of Public Works and Infrastructure, so that when we now reclaim our mandate of maintenance, we have built internal capacity. But we have indicated, as in like now, tomorrow, our plumbers from the department will be here. I've already spoken to Works within the department. Of course, I'm from that particular department. I'm the fortunate one to be retained in that particular department. They will be here tomorrow to see what can be done.
Thank you very much. That is the MEC of Public Works, of course, responding to some of the issues here at Pelenomi. I'd like to just lastly wrap up with the Premier. You have seen with what you have seen when you came here unannounced. From here, what is the Premier of the Free State and her Executive Council members doing?
We're going to be really on the ground, like I indicated, From here, we're visiting other hospitals, your National, your Botshabelo, your Tabanchu. Every district will have to have meetings of executive in different districts, so that immediately after meetings, we visit these institutions, especially the health institution, because I think that's a priority. We can't have our people really being treated in these conditions, because you wonder if you're going to treat me as a patient, but you subject me to this kind of conditions, how am I going to heal as a patient? So we are going to make sure that this collective rotates this province. After every EXCO meeting, we'll go to different institutions and making sure that we had a proper intervention.
We've spoken about health. We have heard you indicating the issue of fighting corruption. Is there any other key area that you are focusing on as you enter your office?
You mean health?
No, as Premier, any key area that you are looking at specifically? We've heard about health, we've heard about corruption as well.
I think the reason we had this collective of men and women is because every department is important. We go to schools, we still have some challenges that we need to address as well. But as we all know that issue of private hospitals is because we are dealing with our people who are desperately in need of this service that is free, that is being given to them. And it affects communities from all ages. But when you go to issues like school, you know that you're going to deal with learners in that particular. But this one is one of those areas that accommodates all people of all ages. So that's why I put it as my priority, making sure that we address, but all other areas are equally important to us.
Thank you very much. That is the Premier of the Free State, Maqueen Letsoha-Mathae, of course, talking to us about what they have found out here at Pelenomi as well. And they will be going to various areas. Of course, as she has indicated, they will be on the ground under her leadership. Alicia will continue, of course, to monitor what is happening on the ground. This is what transpired after that swearing in of the new MECs in the Free State.
Thank you so much for that comprehensive report. The SABC News reporter Makgala Masiteng out in Bloemfontein for us.